Yeah, well, Minister Fullerton's done a great job in long-term care right from day one, and we value all the information as being a physician herself that she could give us. And I just want to say she did a wonderful job.
But did she rang the alarm bells for, she says she rang the alarm bells for the spread in
Hmm.
nursing homes and Mason and spread before Dr. Williams. Did you listen to her?
I listened to all the medical professionals, including Dr. Fullerton, and always take her advice along with the chief medical officer.
Okay, I'm going to a
Could I-
question from Brian Lilly now.
Yep.
And this all deals with the guidelines. They've walked them back in the appeal when Mayor Brown suggested that people are following the guidelines. It means that a 5-year-old would have to stay in a room for 2 weeks at a time. Have you walked back from the guidelines? Did you know about those guidelines before? And if they were possibly exposed to COVID, then you would have to. I can let me hold it.
Yeah, that was a little confusing, that question.
Yeah. Well, Peel Health was walked back the guidelines that small children should be isolated by themselves after being exposed to COVID possible. The general Ontario guidelines still indicate that those dismissed from schools as a result of possible exposure be kept inside the house for 14 days and kept away from other family members. In other words, if your small child had possible contact with another child at school with COVID, they would have to stay in a room for 14 days. Is the province going to back away from that?
I'll pass that over to the Minister of Health.
Okay, then I'll ask her.
Yeah.
I'll go to the Minister of Health after that.
Can I talk about what we're doing here?
Absolutely.
Thank you.
Yeah, absolutely. Yeah.
Well, we're here at the U of T Mississauga, and I just want to thank everyone here for putting this together. They're working collaboratively with the region of Peel, and again, I want to thank Mayor Crombie. Thank you so much, Mayor Crombie, and Dr. Lowe for doing an incredible job here in Peel region. And I want to thank Trillium. This is a collaboration that we're going to see right across the province, no matter if it's the hospitals or the PHUs or even the private sector as well. And we're going to get through this. I'm really happy to announce everyone's following the framework, but also have the flexibility to move forward once they get through their phase one of making sure we vaccinate the most vulnerable all throughout our long-term care homes. And there's a tremendous amount of public health units that are now starting 80 plus. So we're well on our way. The same question is we need more vaccines, but around in the freezer. And here's one example of one of the mass vaccination centers set up from the folks at U of T Mississauga, and I'm very grateful. I want to give a shout out to all the frontline healthcare workers that are putting needles into people's arms. We're very grateful. Get ready. We're going full steam ahead on this.
How many people do you think are going to be able to, you saw how it's operating here, when the vaccines are here and if they're all fully stocked,
Yeah.
you just see a lot of arms?
I was told 200 an hour, correct me if I'm wrong, but I think that was 200 an hour, and that is absolutely fabulous. As more vaccines come in, we'll open up more mass vaccination centers. But again, there's certain regions that are ahead of other regions just due to population and other reasons, but they're already on 80 plus. Some even started last week, so I just want to thank them for doing such a great job.
And Mike Crowley has this question. He says, well, why are some regions ahead of other regions in this plan? Shouldn't everyone be launched at the same day? Why is it dependent on where you live before you get a vaccine?
Well, you have to look at the populations too. Mississauga, Peel is a massive population, so is Toronto, and other regions, be it Guelph, for example, are already into their 80 plus. But we're going to continue moving on, and that's what's great about this framework. You have the flexibility, depending on where you are within the vaccinations, then you get to move on to the next phase.
You're going to see region hopping now. People are getting vaccines in other regions.
Yep.
Is that going to be allowed? Is that going to be filtered out?
I'm sorry, the senior?
Region hopping. You know, if
Yeah, no, you shouldn't be region hopping whatsoever. Stay within your region and get vaccinated within your region. As we get more vaccinations from the federal government, then we'll be able to ramp it up. And let's hope we get some AstraZeneca, and also Johnson & Johnson's absolutely critical.
Thank you, Mr.
Thank you.
President. Minister of Health. Yeah, the guidelines. The guidelines. If a small child goes to school, gets contact, they have to isolate in their home, in their room, using a separate bathroom and fed. There's all sorts of guidelines about even how they're being fed. Is the province going to back down from that for small children?
Those guidelines have been clarified, as I understand it, by Dr. Lowe, and he's here. Perhaps he'd like to speak to that directly. Yeah. Thank you.
Okay, Dr. Lowe, thank you.
Thanks so much.
See you there. Sorry about
Yeah,
that.
no worries. Thanks so much. So it came to my attention over the weekend that a communication product put out by Peel Public Health contained an error. This product has since been removed and is currently being revised. The product does not state our position in respect of isolation of children. There are recommendations on our website with a recognition that children cannot self-isolate, and they do need to self-isolate with a parent or guardian. It is important that these guidelines were done with the best intentions, with a recognition that household transmission does continue to be a significant source of spread in our community, and to the extent that we can balance the risk of transmission, certainly with the emotional and physical needs of children, that was where we were trying to go, but the product has been removed and is being revised. Thanks for the question.
Was it just not following the provincial guidelines?
So no, again, this was an error made on a communication product. It was not a difference in the positions with
Thank
products.
you, Dr. Lowe.
Thank you.
All right, thanks,
And I
Dr.
just need
Lowe.
the general, but you can wait till everyone
Yeah.
clears out.
Yeah.
there.
I think we're good.
Thank you, everyone.
Yeah. Thank you, Premier. Thank you, everybody.
Thank you so much for coming.
Thank you. Great job.
Mayor, thank you once again.
Sharif?
Okay, no, it's okay.